So let's talk about what the ICU means, or what it stands for, and what exactly it is. Hey, this is Thomas from Nurse Money Talk, and so let's talk about what the ICU is. So ICU stands for Intensive Care Unit. So generally speaking, it is the area in a hospital where you're gonna have like the sickest patients. The staff taking care of those patients in the ICU, think, of course, your nurses, your physicians, or your intensivists. You're gonna have respiratory therapy, registered dietitian. You're of course gonna have probably pharmacy there as well. And of course, your advanced practice nurses and your physician assistants, just to name a few. So, and the staff taking care of them, they tend to be, I'm not saying that there aren't other areas of the hospital where you have like well-trained staff. That's not what I'm implying, but it's like, it's almost like you have like very specialized, specially trained staff typically for these positions. And so as for the patients that are normally there, you could be in a situation where generally there are patients that are requiring advanced respiratory support, advanced cardiac support, just like it could be looking at multi-organ system failures. They might be on a vent, in a situation where those patients are literally teetering on the brink of life and death. And so a lot of times in those situations, which gets into why you have the ICU, you'll have the specialized staff, you'll have the, their ratios, especially as far as nursing is concerned. The ratio tends to be, I'm going to say, a lot more generous. Not sure if that's the best choice of words, but there's a better, nurse to patient ratio where, so you're probably in a situation where a nurse is, for a patient that's like really critically sick, maybe on ECMO or something like that, like a 1-to-1, all the way on to like a 1-to-2 generally. I mean, I have heard of 1-to-3 in really, really dire situations as well. But generally, you're not going to get above that. As for the different types of ICUs, so you could be looking at medical ICUs, you could be looking at surgical ICUs, neuro, trauma, burn, cardiac, or cardiac care unit, neonatal, pediatric, transplant ICU. So similar to similar to a lot of medicine, you'll have, you'll have like kind of like your general ICUs that might take, a lot of different things, but then like you'll start getting like these very specialized ICUs that specifically deal with certain things, so maybe like a stroke patient, they'll go to like a neuro ICU. As far as the benefits of ICU treatment, like I already mentioned, it's in a nutshell, specialized staff, less patient ratio, a lot of very advanced equipment to deal with patients who are pretty much like some of the sickest in the hospital. And so the ICUs, or at least my experience has been like typically you're not discharging from an ICU, just kind of like as a fun fact, or just random fact, I should say. And so a lot of times the ICUs, from my experience, they'll actually get their patients from other areas. So like, like say like the ER or something. So they'll get it, from a patient will come into the ER will triage, they'll go to an ICU, they'll be, taken care of, treated in the ICU, and then typically, as the patient kind of meets a level of not needing that intense ICU care, they'll move to a step down, and then, or to the floor, and then from there, they'll be discharged from there. And then kind of like the cycle repeats itself. I do have some more some more videos over like the different specialties of nursing that you'll see that will show up here shortly. And so you can definitely check that out. If you are interested of becoming a nurse to maybe, work in the ICU, check out nursemoneytalk.com/schools. If you are looking for ICU jobs, that's nursemoneytalk.com/jobs. Thank you so much for watching this video, and I will catch you very soon in that next video.